gonna come into the room and I'm gonna wash my hands. Introduce myself. I'm Sierra Hirschman. I'll be your nurse for today. Are you Tyler Isringhouse?
Yep, you got it.
Can you tell me your date of birth, please?
9/19/91.
And we're just here for a checkup, right?
Yeah.
Okay, well, we're going to start out with some questions. Then we will get toe assessment on you. Just for your routine checkup. I'm going to take a seat here in front of you. Excuse me, I'm a little stiff. Just had surgery. So if you could tell me your name.
Tyler Glenn Isringhouse.
And your address.
11291 Oriole Road, Oakville, Illinois, 62271.
And could you tell me your phone number, please, sir?
618-521-3720.
And your birth date?
9/1991.
Thank you. Sorry, I already asked that. Can you tell me about your history of seeing doctors? Do you have somebody that you go to annually, just for a checkup?
Dr. Shaw out of Nashville.
And you've been there this year?
This year, no.
But you go for regular checkups. You just haven't been quite yet this year? Okay, well, the year's almost over, so we better get in there soon. Can you tell me about your ethnicity?
White.
Okay. European descent, I take it?
German.
Okay, and how about your education level? What's the highest level of education you've accomplished?
Associates out of college.
Do you plan to go on?
Perhaps.
Okay, for a bachelor's?
Yeah.
Okay. Tell me about your occupation, please.
I'm a farmer and a welder.
Okay. And then what brings you here today? You're just here for a checkup, correct?
Right.
You're not having any pain or anything of that nature, any numbness, tingling?
No, I'm just getting a good going over.
Okay. Did you have any birth problems when you were born? Any problems breathing? Any genetic problems?
I was pretty good. I know my mother wasn't having a lot of fun, but
that's common. Do you have a history of childhood illnesses?
Nope, healthy as a horse.
Do you have your immunizations up to date?
As in?
Your shots. Do you get like your childhood shots?
Oh,
Mom
yeah.
took you to get those.
Yeah.
Do you get a flu shot?
Yeah.
Pneumonia vaccine?
No.
Do you have a history of any illnesses?
Nope.
Do you have a history of any surgeries?
No.
Any car accidents? Any accidents at the farm?
Nope.
And you said you have no pain?
That's right.
Do you have any allergies?
Nope.
Tell me about your family history. Do you have the standard mother, father, sibling kind of arrangement?
Mm-hmm.
Are your grandparents still alive?
On my mother's side, yes.
Both paternal and maternal?
Yep.
And both on your father's side have passed away?
Yep.
Okay. So do you have any problems with your skin, hair, or nails?
Yeah.
How about your ears? Any drainage, hard of hearing, ringing, tingling, dizziness?
I've been told I have selective hearing.
Okay. Any problems with your mouth, throat, nose, or sinuses?
Nope.
How about your chest and your lungs? Do you ever have trouble breathing?
Nope.
How about your lymph nodes? Do you ever notice in your neck or your armpits or perhaps by your groin that they're swollen or tender?
Nope.
How about your heart or your neck vessels? Do you ever notice that they are distended or anything of that nature?
Nope.
Any problems with your feet such as tingling, numbness, loss of sensation?
Fiancé say they smell bad, that's about it.
But it has nothing to do with your circular system, but we can look into that smell. It might be a fungus or something. How about your abdomen?
A little flabby, that's about it.
No masses or pain or anything of that nature, nausea? Okay, and how about your genitalia? Do you have any sores, cankers, itching, smelling, drainage, or anything?
No.
How about your anus, your rectum, or your prostate? Have you noticed any trouble peeing?
Nope.
Any problems having a bowel movement?
Nope, pretty good.
No blood or anything? It's not, you don't strain a lot?
Nope.
Okay, how about your muscles and your skeleton? Have you ever gone to a chiropractor or had a fracture, anything of that nature? Any sprains?
Nope.
Okay, and never had a stroke, I take it?
Nope.
Never had any other neurologic deficits, concussion, amnesia, anything like that?
Nope.
Okay, can you tell me kind of about your typical day, the things you do just to care for yourself? Like when you get up, Do you
Brush
go
my
for
teeth.
a walk, brush your teeth? You're able to do that? Do you cook yourself breakfast?
Most of the time.
I mean, you're capable of cooking yourself breakfast and lunch.
I can
supper.
figure out how to make some eggs, yeah.
Okay. And you drive yourself to work.
Yep.
And you get around your house and navigate stairs and everything. Okay.
Yeah, I can see.
Okay. Tell me about your diet in the past 24 hours.
Oh, I just had a cookie.
But what else have you eaten? What did you have for dinner and for lunch?
Some vegetable concoction for supper. Surprisingly good. Lunchtime, I had some McDonald's. Oh, I had a chicken sandwich and something else off the dollar menu. And this morning, I had some cereal, I believe.
Okay. Do you have an exercise regime?
Work.
How about your sleep? Do you generally get 5 hours of sleep, 6 hours, 8 hours, 10 hours?
Oh, most of the year I get about 7 hours. Whenever we're busy, I get 5 maybe.
Do you feel like they're restful for you?
Yeah, for the most part.
Do you use any medications?
Nope.
How about recreational drugs such as heroin, marijuana?
That's in the 70s now.
Well, you weren't alive in the 70s, sir, so that'd be impossible. How about alcohol?
Seldomly.
What seldomly? Does that mean 3 times a week, once a week?
Yeah, 3 times a week.
Okay, and those 3 times a week, how many drinks is that?
1 or 2.
And by 1 or 2 drinks, do you mean 1 or 2 shots, 1 or 2 beers, 1 or 2 glasses of wine?
1 or 2 beers.
Okay. Any nicotine use?
Nope.
And how about caffeine?
Coffee.
Okay. Any soda or anything?
No, not normally.
How do you feel about yourself in general? Do you think you're making a good way in life? Are you happy with where you're at?
Yeah, for the most part.
Do you have any life stressors?
Not really, no.
If you were to have a life stressor, what kind of coping strategy would you have?
I'll probably go tinker in my shed or something like that.
So you have outlets that you like to use?
Oh, yeah.
Okay, tell me about your responsibilities at home.
Basically whatever the little lady wants me to do.
But do you have bills? Do you have...
Oh, yeah, bills.
Okay. And you're okay paying those?
Yeah.
How about your responsibilities at work? Don't fall asleep on me.
No, just whatever needs done, I go do.
Okay. And you said that you farm and you weld. Are you satisfied with that as your career path?
Yeah.
Good.
Puts food on the table.
Well, that's good. How about your finances? You said that you feel comfortable and satisfied with them.
Mm-hmm.
And you told me for your educational plans that you plan to go back to school possibly for a bachelor's.
Yep.
That'd be a bachelor's in like egg business.
Ag business or go to technical school, maybe get a welding degree.
Okay. What kind of social activities do you partake in? Like, what's your typical weekend?
Oh, hang out with the guys, go have a couple drinks, take the fiance out on a date, whatever I feel like.
Okay. So you said that it sounds like you have a good support system with your friends and you have a fiance.
Mm-hmm.
Are you happy with all of that?
Yeah.
Good. Tell me about your values in life.
Faith, family, farm.
Okay. Simple enough. Are you spiritual? You just believe in something bigger that you find happiness and joy?
Yeah, I believe that.
Good. Are you affiliated with any religions in particular?
Catholic.
Okay. And you said that you live in a home and you're a farmer, so I take it that you kind of live in a rural environment.
Out in the country, yes.
In an older home, and you're not in a neighborhood.
Right.
Okay, well, that concludes all of our questions, so now I'm going to start with the head to toe exam. I'm going to first begin by just observing your appearance. I can see that you're clean, you're well kept, there's no odor, your skin color from what I can see looks good. I can see that you're not obviously dehydrated by your skin, your veins. You're calm, appropriate, and cooperative. At this time, I would assess his vital signs, temperature, heart rate, pulse, blood pressure, and I would listen to his heart and his lungs with my stethoscope. I would take body measurements. I would want to know arm circumference. I would also want to take calipers on his arm and probably measure that. I would want a waist to hip ratio, how tall he is, how much he weighs. And then at this point, I would also use a Snellen chart to test his vision. I would want him to read the highest level of letters that he can. Moving on to the mental status exam, when I was asking him questions, I assessed his level of consciousness. I can tell that he is conscious, he is alert, he is oriented to person, place, and time. His body posture is appropriate. Body movements are within functional limits. His facial expressions are also appropriate, calm, cooperative. His speech is fine within normal limits. His mood seems appropriate. His feelings and his expressions are also appropriate. His thought processes are intact. His perceptions are intact. Cognitive abilities seemed intact. At this point, if I was questioning it, I could have him do like a mini mental state exam or that type of thing. I'm not worried about getting a specimen, so a specimen cup is not needed. At this point, I'm going to get a closer look. I'm going to look at your skin, sir. Move this chair out of the way. Put your foot down, please. Okay, so overall, I'm looking at his skin color, any variations. I wouldn't want any shadows casted from myself onto him. I would feel temperature, move down to the legs, make sure the temperature is equal there, that there's no coldness or coolness. I don't know any lesions at this point. At this point, it would be a good opportunity for me to teach you a skin examination. The purpose of this is to find any lumps, but especially any cancerous growths, like such as moles. So before you get into the shower, while you're in the shower, it's important to look at the backsides of your arms, especially since he said that he's a farmer. This arm's going to be in the sun, in a truck, and in a tractor. Note on your stomach, on your bottom, your legs, looking between your toes and the bottom of your feet as well. Excuse me. So I'm going to inspect and palpate his head next, noting any lumps. I obviously would just observe it first. It is symmetrical, consistent. The distribution of hair is equal. The color is equal throughout. His face is symmetrical. Features are appropriate. His expressions, they were appropriate while we were visiting. And the condition of the skin is perfectly fine. It's intact. It's clean. There's no acne.
Clear yourself.
Hair growth is even. He's funny. Could you smile for me? And frown. Like, make your lips go down like this. Okay, good. Can you show your teeth? Bare your teeth. Puff out your lips. Good. Raise your eyebrows. And tightly close your eyes for me. This assessed a cranial nerve in your head. Or in your spine, I'm sorry. Okay. So now I'm going to touch your forehead. And this is touching your cheeks as well. This is assessing for cranial nerve 7, the facial nerve. Could you feel that, sir?
Mm-hmm.
Okay. Let's see, I want to palpate your temporal arteries. I can feel them just fine, a nice pulse, and they are nice and soft, not rigid. And open your jaw for me, please. Good. I'm assessing the temporomandibular joint. Okay, so now I'm going to assess your visual function. I'm going to first inspect, like I always do. I'm looking at your outer eye. I don't note any drainage or any swelling, redness, any like pustules or anything of that nature. I'm going to take my pen light, assess your pupillary reaction. If you could follow my light now. I'm testing all the visual fields. Okay. And I tested accommodation. That's intact. Corneal reflex. I'm going to take this wisp of cotton and touch your eye. And you reacted. At this point, I would take my ophthalmoscope and look at your eyes, check for the redness. I see it, you're good. I'm going to move on to your ears. At first I would just look at your auricle, the outside, your tragus, and one other part, the lobule itself. I don't know any drainage, they're symmetrical. They're at a good point with your eyes as far as childhood development would have been concerned. I'll palpate the auricle and the mastoid process. Okay, and now I'm going to use an otoscope and look in your canal. I don't see any debris or foreign bodies. Looking at the tympanic membrane. At this point, I could have him stand up and I would do the whisper test to check for hearing. I could also do the Romberg test and the Rhine test. That would also check for his balance. Excuse me. Moving on to the nose, I look at it, it's symmetrical. There's no drainage. Look at the septum. It's not perforated. Let's see. Is there any tenderness? Can you blow out? Sorry, can you blow out? Okay. The airflow is not equal. This side is very stuffy. Oh, and then I would want you to smell something, but I would include this one. Smell. Could you smell the same?
Yeah.
That's checking another cranial nerve. Use my otoscope, look in there again, and I noted that your septum's not perforated, and now I'm going to transilluminate your sinuses. This one looks like it could be a little impacted. Okay, I'm going to don gloves. Can you look? Don't look scared. I'm just going to look at your lips at first. They look normal. They're not dry. They're not cracked. Could you open your mouth for me? Smile. Bare your teeth so I can see them. Teeth look all intact. Let me see your gums. Open up. His gums look a little red, and they actually look a little pale. On this side. On this side they look red. Open up again. I'm looking at the soft and the hard palates. They look fine. Oh, open up again. I need to look at your uvula. Good, there's just one. It's dangling. Okay. Check for the gag reflex. I could just stick a tongue depressor in the back of his throat. I would look at his tonsils at this time, make sure there's no exudate. I would palpate the tongue, make sure there is no masses or tenderness. There's no fuzz or anything. I would want to assess his tongue strength, so I would ask him to push up with his tongue against the tongue blade. And I would ask you to eat a piece of chocolate and see if you could taste it okay, and that would be assessing for another cranial nerve. Moving on to your neck. Neck looks fine. There's no visible pulsations, there's no lacerations, no rashes, no huge lymph nodes. Turn your head to the left, please, and turn your head to the right. That's checking the range of motion. I'm going to palpate a bunch of lymph nodes, so just look forward for me. None are palpable. Feel the trachea. Feels within normal limits. Give me a swallow, please, sir. That's feeling his thyroid. It was felt, and for my scope of practice, it felt fine. So there's no need to auscultate to it. I could listen to the carotid arteries. I should not hear any whooshing sounds. I would listen to them at separate times, obviously. And I see your hands and your arms. We're moving on to the arms now. I'm expecting the appearance. If you could please shrug your shoulders against my hands. This is checking, push up. This is checking another cranial nerve. It is intact. I'm going to palpate your arms. No obvious masses. Could you please flex your elbows? Range of motion is intact. Okay, brachial pulse, palpating it. It's normal. Going to palpate your radial pulse. I would say 2+ and regular. Palpate your ulnar pulse. 2 plus, and regular. Checking the range of motion of your wrist, that seems to be intact too. At this point, if I had a reflex hammer, I would check his bicep, tricep, and brachioradialis reflexes. Okay, just move your hands for me. Good, checking the rapid alternating movements. And when I touched him on his arms, he did not complain of any numbness or tingling, so I know that the sensation is indeed intact. Okay, so please continue sitting. Okay, and put your arms at your side. At this point, actually, if you could kind of turn this way so I can get to your back. Thank you, sir. So I'm going to look at your scapula, which are, oh, I can't think of the little bone. I can't think of the other name for them. I'm looking at your chest wall. I do not know any accessory muscle use when he's breathing. Going to palpate the chest. I'm checking, take a deep breath for me. I'm evaluating chest expansion at T9 and T10. And then I'm going to percuss every intercostal space. Should be just not a horribly dull sound, but it shouldn't be high pitched. Okay, another deep breath for me, please. I am checking for a diaphragmatic excursion. At this point, I would use my stethoscope and I would listen at the upper areas of the lungs, middle, bases, and the sides. Can you tell me how many fingers I'm touching you with, sir?
1?
Yep. How about now?
1.
And no?
1.
No, you failed the 2-point discrimination.
It's a loose shirt.
Okay. Let's see. If you could turn back around for me, sir, I'm going to listen to your heart at the left sternal border and at the apex. And up to the apex. So third intercostal space. Excuse me. I'm going to look at your anterior chest now. I see no accessory muscle use. Your quality and pattern of breathing, except for the excessive yawning, is fine. Could you sit forward? I can't see you. There you go. Intercostal spaces, there are no retractions. I'm going to palpate your anterior chest. I feel no crepitus. Going to percuss. It too sounds fine. Going to listen in the upper areas, upper lobes, I mean, middle. And again at the bases. Move your skin around. I see that the skin mobility is fine. The turgor is fine. If you could fold your gown, he has a gown on. If you could fold your gown down, I'm going to assess your male breasts and your nipple area. So I'm looking at the breast tissue. I notice that he does not have breasts, so he does not have gynecomastia or anything of that nature. I'm going to palpate again, even though I just did. It's not fibrous or anything like that. There are no masses. Okay. Going to check your venous jugular pressure.
Shall I put my top back on?
Yes, that's fine. Okay, so now I'm going to again listen for the apical pulse because we're moving on to the heart. Palpate the apex, left sternal border, and the base of the heart. Listen over the aortic area, pulmonic, Erb's point, tricuspid, and again at the apex. At this point, I would have him lay on his left side so I could listen to the apex from that point. Okay. I'm going to look at your abdomen now. The client would be laying down. It's a little bit easier for me with him like this. So first I would inspect the abdomen. Then I would auscultate the abdomen, listen for vowel sounds in each 4 quadrants. Percuss the abdomen. I know dullness, no tympany, suggesting that there's no air. And now I'm going to palpate the abdomen. I don't feel the liver under the ribs. The spleen is not noted. No other masses or hardness. At this point, I would roll his gown up a little bit so I could look at the muscles of his legs. I'll look at hair distribution. It's evenly distributed. Palpate, the hips and the knees. I saw the client walk into the hospital, so I know that the range of motion of his hips, his knees, and his ankles are indeed fine. Palpate the rest of his legs. Palpate his knees. Palpate his ankles. I would assess for capillary refill and check his pulses at this point down here. Post-tibial, dorsal pedis, and post the ankle one. Capillary refill should be less than 2 seconds. His sensation's fine. If you could stretch out your right leg, sir. Take this heel, not all the way stretch out, sorry, it wasn't clear, just keep it like that. Take your left heel and run it up and down your shin. So he passes the shin to the heel test. There are no other special tests needed. At this point, if you could again face the wall. I'm going to look at your spine. I would have him stand up and bend over, and I would look for any spinal curvatures. I assessed his gait when he walked into the hospital, and I saw him do that. Sir, could you please stand up and hop on one leg? Okay, he stood up and hopped on one leg for me. When I was doing his hearing, I did the Rhine and the Romberg, so I would not repeat the Romberg. That's a test of balance. And if you, while you were standing, if you could place your finger to your nose. Good. And your other one, please. Perfect. Okay, sir, we are going to move on to the male genitalia. Do you have any concerns or questions for me before we do that?
Yeah, I'm all good.
Okay, please turn around. Okay, so I'm going to sit on my stool again. Okay, so first I would begin, as always, by just inspecting the penis. I would look for any urethral discharge. I don't see any. I would inspect the scrotum next for any weird hair distribution, any weird skin discolorations or growths or anything of that nature. I would be looking for cankers or scabs or anything of that nature. I would palpate both testes separately, make sure that they're separated and that there are two of them that have descended. Feel for the epididymis. Transilluminate the scrotum itself. That would be normal. I would expect for any bulges in the inguinal and femoral areas. First I would inspect and then I could feel. I would palpate for scrotal hernia, palpate for an inguinal hernia. At this point I would like to teach you about testicular self-examination while you're in the shower. If you just take your scrotum in your hand and palpate your testes separately and just note any masses or pain, anything like that, that should be done monthly, sir. So at this point I would have the client roll over, and so I could inspect, well, first I would just look at the general perineal area, but then I would want him to roll over so that I could look behind the scrotum and move on to the perineal and the rectal area and the sacrococcygeal area. Actually, I would want you to stand up so I could look at your rectal area and bend over. First I would inspect, and then I would palpate the anus. I would palpate the external sphincter, palpate your rectum, palpate the peritoneal cavity, palpate your prostate if I can, and if you're able to give me a stool sample, I would take a stool sample. Do you have any questions, sir?
No.
Okay, well, if you could put your gown back on and take a seat back on the bed, I'm going to go chart, and I will let your doctor know that you're here.
That'll work.
Pleasure meeting you. I'm going to get up and wash my hands. Thank you.
Thank you.